Okay, Paula, we are ready. Stream is starting in 5 seconds or so, and you can start. Thank you.
Madame la Directrice Générale, Excellences, chers collègues, Mesdames et Messieurs, j'ai le plaisir de vous accueillir à cette séance d'information virtuelle sur la situation sanitaire liée à la pandémie ici à Genève, ainsi que sur les dernières mesures prises par les autorités fédérales et cantonales. Pour moi, c'est la première fois que je fais ce briefing de ce genre depuis ma prise de fonction, mais la mission suisse renoue ainsi avec la tradition instaurée au printemps des séances d'information à l'intention des organisations internationales et des missions permanentes. Nous avons bénéficié depuis le mois de mai d'une évolution favorable de la situation épidémiologique, accompagnée d'un retour progressif du personnel des organisations internationales et des missions permanentes sur leur lieu de travail et surtout de la reprise de nombreux processus multilatéraux, souvent en format dit hybride. Mais voilà, en l'espace de quelques semaines, la situation s'est rapidement détériorée à Genève et en Suisse, comme un peu partout ailleurs sur le continent européen. Ceci a amené les autorités fédérales suisses et les autorités cantonales genevoises à adapter leurs dispositifs pour lutter contre la pandémie et à décréter une série de nouvelles mesures.
To adapt their systems to fight the pandemics and to decree a series of new measures. The Swiss mission communicated in writing whenever new developments occurred. The purpose of today's meeting is to present to you the latest developments in Switzerland's response to the pandemic, as well as an overview of the situation in Switzerland and more specifically here in Geneva. Furthermore, we thought that the prerogatives and the functioning of the Cantonal response crisis team could also be of interest to the actors of international modalities of Geneva functioning. To address these themes, I have the pleasure of welcoming 3 panelists today. Mrs. Reina Forer, co-head of the Global Health Section at the Federal Office in Public Health in Bern, Dr. Aglaé Tardin, head of the Cantonal Medical Service in Geneva, who succeeded Professor Jacques-André Ramon, who had taken part in 3 briefings organized in the spring, and finally, Mr. Jérôme Fillet, Director General and Head of State Cantonal Crisis Response Team of the Canton of Geneva. Before introducing our 3 speakers, I would now like to give the floor to the Director General of UNOG, Ms. Tatiana Valovaya, for some introductory remarks. You have the floor.
Merci. Friends, first of all, I would like to thank our host country for organizing this briefing. I would like to say that from the
Merci l'ambassadeur, chers amis. Tout d'abord, je voudrais dire qu'au début de cette situation, nous avons œuvré et collaboré très étroitement avec tous les pays et toutes les entités. Donc, je voudrais...
United Nations stand alongside our host country in combating the virus and promoting a strong multilateral system. I would like to say that we in the United Nations, together with all the entities of our UN families, have been meeting regularly within the framework of security management team all these months. We've already had 20 meetings, and during all our meetings, the representative of the host country, also as representative of France, participated, and that allowed us to have a common approach and to discuss how we could better assist the host country in fighting the virus, at the same time going on with our activities. I just would like to inform you that since we resumed our conference activities here in the Palais des Nations till the 1st of November, we've conducted 856 in-person meetings and also 957 virtual and hybrid meetings. So we got accustomed to working in this new normal situation. The decisions taken by Canton of Geneva, as also by Federal Council, as a result of the deteriorating situation in Switzerland and in Geneva, have led to certain changes in our activities. I would like to inform you that starting at the beginning of this week, we are requiring our staff to telecommute unless their presence is needed on site. And those who can work only on site are going to do this on site. I would like to say that Palais des Nations is not closed. We're going on with our crucial activities, including conferences. Starting this week, following the decisions of Canton of Geneva and later Federal Council, all our in-person meetings are limited to 5 persons, not including the personnel who is servicing these meetings. And we already are conducting some meetings in this new format. You might be aware that we're now conducting this 36th session of UPR in this format with only 5 people present in the room and the rest following via WebEx. And people are changing in the room when they have to report. And we are now talking to our other clients how to better organize these events in a similar way. At the same time, we are now discussing with the organizers of a planned conference on Afghanistan, which should take place on the 23rd and 24th November, how to better suit this modality for them, and they are planning to increase the virtual component of this meeting. So I would like to assure you that we're ready to go on with our activities, but at the same time, of course, we have to follow the guidelines from our host country, and I would like to assure you that our cooperation is very, very active, and we are standing ready to support all the efforts and the decisions made. At the same time, supporting the multilateral and intergovernmental activities. Thank you. Over.
Merci beaucoup, Madame la Directrice Générale. J'aimerais de mon côté vous remercier pour l'excellente coopération.
Thank you very much. I would like to thank you from my side for the excellent cooperation that we had. I now give the floor to Mr. Tim Yee, Chairman of the WTO Task Force on Health, also for some introductory remarks.
Thank you very much, Ambassador, and thank you to the Swiss mission for organising this meeting. I'm pleased to be able to represent the WTO and to provide you with a short update. Reflecting the current difficult environment with the pandemic, we have responded through a further tightening of our health measures to make sure we are in line with relevant Swiss and cantonal directives. In particular, through further movement to have as many staff working at home as possible. We currently have around 20 to 25% of staff in the office, so less than 200 people. This has dropped from around 45% a couple of weeks ago. As of last Monday, we have also started to enforce meetings of no more than 5 people, particularly through now convening all meetings of delegates through virtual platforms. Protection of staff and delegates in the WTO building nevertheless remains a key priority. As we have done since the commencement of the pandemic, we are continuing to take the temperature of all people entering the WTO premises, providing masks and asking for them to be worn at all times in the building in public and meeting areas, ensuring the regular disinfecting of all offices and meeting areas, ensuring we have effective quarantine and contact tracing procedures in place, and we are regularly advising staff of the situation and reinforce the need for appropriate care to be taken. And of course, we are keeping our WTO members regularly updated on the situation. This perhaps explains why our numbers of staff who have tested positive, currently 8, has not thus far been growing at an exponential rate. We also have 38 people, staff members, I should say, currently in quarantine. Importantly, there have been no instances of transmission at the WTO premises itself between staff. So we continue to believe that we are providing a safe workplace for our staff. But obviously all our measures are under constant review. To finish, I would just like to thank you again for this meeting. These kind of briefings are extremely useful to get the latest information from the Swiss authorities and to stay in close contact with the UN system in Geneva. So thank you very much.
Merci à vous, merci beaucoup, Monsieur Yond. Nous allons maintenant faire place à nos 3 intervenants. Après ces interventions, nous aurons du temps pour répondre aux questions. Je vous invite à poser vos questions par écrit à l'adresse qui vous a été communiquée. Nous conclurons ce briefing à 11 heures. Nous ferons de notre mieux pour apporter une réponse aux questions posées. Si nous n'avons pas assez de temps pour répondre à toutes les questions, nous fournirons une réponse par écrite. J'ai le plaisir de passer maintenant la parole à Madame Rena Forer, co-chef de la section santé globale auprès de l'Office fédéral de la santé publique à Berne. Madame, vous avez la parole.
Merci beaucoup. Je vous remercie pour me donner l'occasion de parler à vous tous et j'ai le plaisir de représenter l'Office fédéral de la santé publique ce matin. Je partage avec vous une présentation que je vais essayer de mettre. Voilà. Je présente ci-après les mesures décidées par la Confédération de la semaine passée. Il inclut les informations par rapport aux capacités en matière de tests et la politique actuelle en matière de voyage. Je terminerai avec une nouvelle vidéo qui est nationalement diffusée à partir de la semaine prochaine. Je commence par la situation épidémiologique actuelle. Il faut encore mentionner que les chiffres d'aujourd'hui ne seront publiés qu'à partir de midi. Et pour information générale, il y aura aujourd'hui aussi un point de presse à 2 heures où notre nouvelle directrice de l'Office fédéral de santé publique va...
Where our director of public health will speak about the actual...
Aussi pour la situation des hospitalisations et la relation avec les
on hospitalization and the relation with hospitals in general. Yesterday we have had 10,088 new cases and 362 new deaths. We have on the 18th of June, the Council has decided to put end at the extraordinary situation, and the Confederation supports national cantons in their epidemic measures. We can always take the measures of the cantonal, the federal authorities can take the cantonal measures, but only after consulting the cantons. The Federal Council is agreeing that the actual situation can be managed by the local authorities. the tracing of chains of spreading is the best measure so far in order to fight the pandemic. There is after the high increase of cases in the whole countries, the Council has adopted on the 29th of October new measures that will lead to fighting the spreading of the disease. As far as the situation allows, the Confederation role will stay auxiliary. The public gatherings are limited to 10 people, and meetings in the open space of more than 100 people are also prohibited. Sporting and cultural activities with more than 15 people are also prohibited. The learning of higher education is also done at the distance learning. The nightclubs and the discotheques are closed, and regarding bars and restaurants, there are they are reduced to 4 people per table. The employers need to have as many people as possible working from home. Several cantons, particularly all the cantons that are bordering with France, have to have all the minimum measures at least. They have to close the sporting events, the bars and restaurants, and all the non-necessary activities. Starting from the 2nd November, rapid antigen tests may also be used to determine a COVID-19 infection. They will allow to faster and more widespread testing and enable more positive cases among the populations to be identified and isolated rapidly. We will have around 30,000 tests per day. The results of rapid test is less reliable, but this type of test is useful because it allows us to put people in isolation if the results are positive. The tests are viable for people who are presenting symptoms of viruses since more than 4 days. Last week, the Federal Council has adopted the rules regarding the traveling. This is from the 29th of October. This is on this measure. Only countries and areas with an incidence rate that is higher than 60, than that in Switzerland, will be placed on the quarantine list. Andorra, Czech Republic, Afghanistan, etc. In France, to be sure, the region Île-de-France, Polynésie, Française, etc. The list will be updated next week. Regarding the traveling, the list of people infected by the coronavirus is available for all the countries in the world. So we have conceived the instructions for traveling to all these countries, but we are inviting people not to travel to foreign countries if possible. In parallel, the communication means announced by the Federal Council are deployed on the following thematics: to meet as little people as possible, to wear masks, to reduce private gatherings, and if possible, work from home. I will show you the new video that is entitled "We Are All the Federal Council." I will finish my presentation with this video, and I stay at your disposal for any questions.
Gesundheitswesen jetzt abzuwenden, braucht es uns alle. Anche l'economia ha bisogno del nostro sostegno. Diese Krise überstehen wir nur, wenn wir zusammenhalten.
Jane, Satin, Eve, around Schule.
Damit wir bald wieder feiern können. Damit das Teich endlich irgendwann vorbei ist. Nous réduisons nos contacts sociaux au strict minimum.
Tragen an allen öffentlichen Orten eine Maske.
Aktivieren wir die Covid-App.
Teniamo la distanza e laviamo regolarmente le mani.
Nehmen wir die Sache ernst und heben durch. Et rappelons-nous, moins nous voyons de monde, moins nous prenons de risques.
Merci beaucoup, Madame Forel.
La situation est grave.
Thank you very much.
Merci beaucoup, Madame Forel. Merci aussi.
Thank you very much. Thank you for this video that we are going to diffuse next week. And I'll have a pleasure to give the floor to Madam Director from Cantonal Physician. I will start to talk about all the statistics that I will send you by email, but also I'll make all the links available so that you could see all the numbers and all the figures, as well as a weekly report that will be published Wednesday evening. We do have about 2,000 who are hospitalized, and there are 38 people in intensive care who is in charge of these medical cares provided are actually experts, and they all know and they are aware of this very serious situation that we have in our intensive care units. So basically we had 65 people who used to be hospitalized, but now this number even goes beyond that number. This is really a very difficult situation, because we cannot rely anymore on simple measures that are implemented. I will try to explain you. In March and April, we had 450 people. Since 2 weeks, we've had the isolation measures in Switzerland, but thanks to measures, we do have some sort of slowing down of the epidemic. The peak has not yet been reached, but we don't know when it will be reached, but we do know that eventually it will be reached. But basically, with the number of diagnosed and officially recognized cases, we can actually understand that the peak, although a bit belated, will certainly be reached. So the situation is clearly alarming. Even private clinics have been involved, so that all the beds we have in hospitals can be actually devoted to COVID patients. We actually do help one another, but we actually needed to include more clinics now, since last week, which was not the case at the beginning of the epidemic in spring. If we talk about medical staff and about coordination, we need to be coherent when we speak about strategies and methods and all the measures implemented. The role of everyone is to be responsible enough and to get tested. We actually just spoke about that, but next week we will actually be able to increase our testing capacities. But please, everyone who has any kind of symptoms must talk to their general practitioner in order to get diagnosed as soon as possible. Another measure that has been brought up by my colleague is actually to impose restrictive measures which have already been applied in some countries, but we do not know whether the legal framework actually can provide support for this kind of measures. So on the personal level, we can maintain and increase social distances. We can all actually start working from home and not to participate in gatherings. So in my opinion, these were the key points, but I will be here to answer all your questions. Thank you for your attention. Thank you for all the clarification, and thank you for all your transparency and your honesty. I will give floor to Mr. Fuller. You have the floor.
Ce briefing.
Thank you for organizing this briefing. Maybe to begin with, I will briefly remind you what ORCA is about. It supports the political authority in exceptional situations, and we all understand that we are now in this kind of situation. This dispositive is decided by the state. And this has been started now also. And the authority of ORCA is to support public authorities in the cases of crisis, in the fight against the crisis. In terms of management of the situation today, the public authorities are, of course, the ones that define the activities. And there is a committee that has cantonal doctors. They have the representatives of authorities and medical authorities. And of course, there are experts all joined in this general directorate. That can be the judicial direction of the department, the office that is charged of working places, etc. This organization can have meetings if the public authorities decide to organize a meeting, and that is how we have the decision to start ORCA. ORCA has a mission to support this committee, but also to support the cantonal doctors and the health authorities. We also had another problem that had to be managed. It's the closing of borders that had a lot of issues about public safety. Today we have put in function this dispositive. We have a health cell that gives priority to health activities. There is a logistic cell that and the NRBC cell to monitor the situation on the epidemiology, and the police cell about the security questions that might arise. Our activities are also regarding the disinfection of vehicles. We need to give all the services that are asked by the authorities in order to manage the crisis and control the situation. Madam Tardin has given you a review of the situation, and we are doing our best in order to support them in the exercise of their function. We can give all the necessary elements in the articulation of the action in the fight against the COVID. We have also collaborating with the General Direction of Health and also with the armed forces in Bern. And this will be maybe in a more limited measure, because we have asked, before all, health support, but we have also had security input, especially regarding the border control and etc. We also would like to continue the relations with the Swiss mission and to see what can be done for the international community that is very present in Geneva. What is also very important our relations with the French authorities, but also with the neighboring canton, Canton de Vaud, in order to see what are the measures and to be informed about any measures and what is being done. I am keeping my links with all my colleagues from Switzerland in order to see what could be eventual support that we could give each other in this situation. So, excuse me, we are not hearing the speaker anymore. Mr. Stelle was disconnected. Thank you very much for your intervention and all your teams that are working on the fight with the virus. We are now going to the question and answers phase.
Chef des opérations de la police cantonale genevoise.
So we will pass to the Lieutenant Colonel François Waridel. We will have also with us Laura Lanchetta-Mead, who represents the legal department of the Department of Security, Employment and Health Service Control Geneva, as well as Sylvie Huffer, Deputy Head of the Diplomatic and Consular Law Section, Direction of Public International Law in Bern, who can also answer specific question if necessary. And I give the floor to Ms. Paola Cerezetti, spokesperson for the Swiss mission, who will moderate the question and answer session. Thank you very much, Mr. Ambassador. I will start with questions for Ms. Tardin. And the question actually is about rapid testing, their reliability, and the possibility to procure them, because there are people who say that basically there are no tests. Yes, actually, we can't find them anywhere. Bern actually sent them to different cantons, but we do need to see first how to implement them, what will be the strategies, and which basically institutions or pharmacies will be able to distribute and use them. Of course, they will need to be deployed everywhere, but it's not the case now. So basically, the swab will be taken from the nose and throat, and it should be performed by someone who knows the procedure. So the difference between the PCR test is that directly we put the swab with the kit, and we will have the results very, very swiftly. So the person won't be
Ça présente un petit inconvénient.
able to actually wait for too long, 24 hours, to have the results of the test. Given the great number of tests that should be done and the number of persons that might be infected, we do need to have rapid tests. We actually want to be able to detect the number of positive cases in all the cantons. So this is, I think, my reply to your question. Thank you very much. I will continue to ask you the questions because actually we do need to know what is the procedure to follow in case of suspected infection. So are there services, what should be done if there's an infected case in an embassy or in a mission or in a diplomatic service? What do we actually need to do if we need to disinfect the premises? When we have a positive case, the procedure from the workplace will actually depend on measures that had been in place since the beginning. If the measures had been actually implemented, the personnel wouldn't have at all had a contact, because during the meetings everyone needs to wear a mask and to respect the social distancing. So basically, if all the measures had been respected, there wouldn't be actually any quarantine measures. I really insist on preventive measures because actually these are the ones that will help us eliminate all sorts of catastrophic scenarios. So basically all the premises need to be constantly aired. The windows need to be open at all times when the weather actually allows it. Everything needs to be disinfected. So the floors, all the surfaces, tables, everything basically that is being touched by the personnel. So if someone is infected, the person receives automatically a form by SMS, and the person needs to basically give us the information about other people that the person had contacts with, about places where he had been. So, based on these information, decisions will take place if actually the persons need to be put in quarantine, in isolation, or tested. For the moment, all these procedures have become automated. We did have a little pause when the number of cases actually risen considerably, but now we are actually able to contact everyone within 24 hours. I really hope that I gave you the answers to essential questions, but the most important is basically to see which are actually the less formal contacts that a person had, whether the person had been carpooling, whether the person had been going to cafes. So we do need to maintain even mask wearing masks at all time. So, and basically, it would be good.
Interpreters are asking us to try to keep a slower pace in our interventions. I have a few more questions that are for you, Ms. Tardin. It is regarding the saturation and of the hospitals in Geneva. Are there other hospitals in Switzerland that can have patients from Geneva? Of course, today we have a national coordination and the intercantonal coordination as for all regarding bed hospitals, intensive care, etc. We have to be clear, but this coordination has sense only if the other hospitals have capacities in Switzerland, meaning that they have some free beds. The hospitals in Switzerland are close to saturation at this moment. Some patients need to be transferred to other hospitals. The transfer of patients to other countries is also limited by the same reason. This solidarity has functioned very well during the first wave, but this time the situation is more critical. We had to refuse in Geneva a transfer from another hospital. We have been refused from another hospital, but it is possible that this situation can be also repeating. The other system that has been put in place and that has been constructed in beforehand, it is a system from a Swiss Intensive Medicine Association. It has been put online also. I need to be clear with these measures. These measures depend on the medical state of the patient, but also about the prognostic of the person. We will give better chances to the people who have better prognostics, but the medical staff will not willingly apply this, but they will be forced to do it because this system will be put in place progressively. But I think that in a certain way and in a certain measure, it will be inevitable. Thank you, Madam. I would like to give the floor to Madam Luqueta from the jurisdictional office. Some are, the question is, if I, as an international organization, am I responsible that the people that come to my meetings or to any events organized have to respect? Am I responsible for them respecting the measures? What is the responsibility of our international organizations? Thank you for the question. Of course, each person is responsible of the place where they meet people, but the host organization is responsible to put disposal the adequate premises, and the response is the answer is that yes, they are responsible for the organizations that they meet in their premises. I will ask you another question. I hope that you are the right person to ask this question. We have questions regarding schools. When there are cases of contagion in schools, what are the rules about communicating the information about this case of contagion? If a student is sick, are the other students informed about that? How does it work inside of schools? I will give the floor to Madame Tardin.
In schools, we need to consider the risks, and that will be done by the medical and by nursing staff. if all the measures had been implemented, if there is only one case, we won't actually do anything because the risk would be very, very low. I have to point out that actually the adults are those who can infect the others, and with the children, this is very, very rarely the case. So we actually need to identify the problem in our system and then to see with the medical team how to inform the parents and how to inform the schools about the measures. Since August, we did put several classes in quarantine. If we talk about high schools and universities, these cases were more frequent because basically they had more context. If they're 22 or 23 years old, they do actually have more contacts than small children. Can we actually assume that the procedures in the cantons are similar? Yes, we can. I don't really know the details. I know they're not identical, but it must be similar. I do want to tell you that we will answer in writing to all your questions that might be too specific. So we do have questions asking about the difference between isolation and quarantine. Could you please explain us the difference, and can you tell us where these decisions come from? All the decisions come from the medical staff from the canton. People who are tested positive need to be in isolation, but actually their contacts need to be subject to similar measures. So now I talk about next of kin. They really need to remain in quarantine 14 days without contacts with other people. Thank you very much. I think that your replies were really clear. We did not have a large number of questions. We did have some questions concerning the topics already addressed by our speakers. So our speakers were apparently very clear, and actually we replied to all questions that were not too specific, and these that will be too specific will be addressed later in writing.
Ladies and gentlemen, I'd like to thank you for your questions as well as your interest in our briefing. I hope that we have been able to answer all of your questions and the doubts that you might have had. Allow me to make a conclusion. The past few weeks have reminded us once again that we must learn to live with the pandemic. While we have become accustomed to finding a certain normalcy as of September, including our professional environment, the latest developments have again forced us to change our lifestyle and our daily routine in a few days. At the moment, we are severely limited in our possibilities to hold face-to-face meetings, but all these measures make sense and follow the logic of limiting interpersonal contacts as much as possible. Who says meeting, says movement of people, which increases the risk of the virus spreading. However, you will understand that today it is essential to contain these risks. That is why exceptions must remain rare and they will be examined extremely narrowly. Thank you in advance for your cooperation and understanding. But at the same time, I remain convinced that professionally we have all made an impressive leap forward this year. The new skills and innovative conference tools, which we have become familiar over the past few months, allow us to continue, at least partially, our work. More than ever, the world needs a multilateral system that works and that is able to generate answers and solutions shared between states in the face of the great challenges we face. It is up to all of us to bring multilateralism to life by integrating new technologies as best as we can in the way we work and by being as flexible as possible to move the various processes forward. We will continue to inform you whenever the Swiss federal government or the authorities of the Canton of Geneva take relevant decisions. The Swiss mission, although most of the staff will continue to work from home for the time being, is open and provides all essential services to the international community. Before concluding, allow me to thank our panelists for joining us today and thank you for attending this briefing today. Ladies and gentlemen, dear colleagues, here we are again in a situation where we have to give up some of our freedoms and certain habits. But at the end, it is only together that we will come out of this crisis. Exit, which of course I hope will be as quick as possible. See you soon. Be careful.